What do you think about that? The Mecca? Anybody figured out that nursing process is important? Yes? Okay, what is nursing process? What do y'all think? Honestly, you guys kind of do the nursing process every day. We all do. What is it called when we do this in real life? Problem solving. Okay? So it is just a fancy way in nursing. It is a process that was developed many, many years ago that allows us to problem solve for our patients, okay? And the thing that I need you to remember is we are not under the medical model. We are not physicians, okay? We are nurses. And so the thing about nursing is we look at things holistically, okay? And so we look at things problem-based. And what we can do as nurses to modify that, okay? So the purpose of today is I had you do the readings, and I wrote out my notes because looking at those 5 chapters and looking at the 98 pages can be a little bit intimidating when you're like, I don't know what's important here and what's not, okay? And so today the purpose is to take you through the process and get you developing a plan of care, because guess what you're going to have to do for the next 2 years in clinical with patients. Not even that. After you graduate, guess what? The RNs, what we're responsible for. Anybody know? Huh? We have to develop the plan of care. We have to modify the plan of care based off of our patients. Sometimes the plan of care guides, especially in long-term care, if it's not on the plan of care, guess what? It can't happen. Okay? So we have to know how to write those plans of care. So the purpose of today is to teach you guys to do that. So by the time we're done with this piece of paper, you're going to put this in a little notebook, and you're going to put this and say, I've got to keep this for the next 2 years so I know what, how this works and what I'm supposed to do, okay? And so you guys all have a book. It may, depending on the version you got, this is the newer version. Some of you have the older version. That's fine, okay? I'm going to teach you how to use this book. You're going to recognize why it's not gathering dust on your shelf anymore. You're going to know this is why I have this book, okay? So what's the first, when we look at the nursing process? What's wrong? What is she doing?
She's a little large.
Okay. She's a little large? Okay. So the purpose, we've got the nursing process. It's a 5-step process. Does everybody know the pieces of it? First is what? Assessment. Second is nursing diagnosis. Third is the plan. Fourth is implementation. And fifth is, yeah, you might as well get that green up here, right up here, okay? And as nurses, you're going to find it's something we do on our heads every time we walk into a patient's room. First thing we do is assess, and all of you are taking an assessment course right now, right? So you're learning that in-depth assessment piece from Barb and from Beth when she was here and from Kat, okay? So the way I've structured this worksheet, I'm not talking a whole lot about assessment because I feel like, you know what, you're getting that in 312. So looking at assessment, I've asked, what is the nursing process? What is assessment and why is it important in the nursing process? Why do we assess our patients? Why do we assess them? Determine what their needs are. Okay. Is everything relevant when we assess our patients? Like when we do a head to toe, you haven't learned head to toe, but you're learning little pieces of assessment. Not everything we see on a patient is going to jump out at us and say that this is a problem. Okay. What are the types of assessments you've learned so far about the types of assessments? Okay, what is the interview? So you've got the interview part, okay? What types of assessments do we have? So we've got the subjective and objective. Have you heard those words before? What is subjective? What the patient says. It is in quotation marks, right? Versus the objective.
What you can measure.
Okay, and where do we gather all that information?
Of like actual diagnosis, is that objective or subjective? Because I've seen it in both.
Well, if a patient, to me, I always thought of objective as being what I observe. Okay. Now, if the patient's telling it to me that's subjective. I've always done the record as being objective because it's what I'm seeing with my eyes. You know what I mean? I don't know. I mean, I don't know if there's a clear differentiation. You know.
In their book, it says that the medical history record or whatever is
Subjective, okay, never looked at it that way. You know, if that's what it says in your book as far as clarifying, because that is what, at some point or another, the patient has told you, then that's what we're going to go with. Does that help, or did I just confuse everybody?
I'm just wondering for for us knowing, because if it says one thing, because I've seen it both, so
Yeah.
to know correctly what it is, or
Okay, so the way, think of it as what I observe with my eyes as being objective is how I would approach it. Okay, does that help you? It's the way I've always approached it in my years of being a nurse. Okay, so assessment is something we're going to gather, and in a few minutes when we get into this case study, we're going to look at assessment information, and we're going to look at how to pull out what's most important. Okay, so when you flip to the next page on page 2, boy, we went through chapter 16 really quickly, didn't we? Huh? Right? Because that's stuff I know that you know. Chapter 17, right?